So Paul gave me this task here. He says, why don't you find a case transcatheter treatment for post-surgical mitral valve regurgitation? So my disclosure is that I'm approaching 50 mitral clips, and of course I'm not as cavalier as him, trying to fix things that the surgeons didn't quite fix. So I just asked him for a case. So I'm sharing a case. I think I was in that case, but I didn't do that case. But anyway, so at some point I will approach those cases too, but I think we did it. He showed me how to do it. So this is a 87-year-old female, and she has a status post-mitral valve repair, and that was an incomplete annuloplasty ring about 5 years ago. And at that time she had a mitral valve prolapse. She now has, we'll show images, but she has a small posterior leaflet, and there's malcoaptation, severe MR. She also has pulmonary hypertension, atrial fibrillation, and she's referred for a transcatheter option. So here's the Transthoracic Echocardiogram pre, and it shows, is it playing here a little bit longer? Yeah, it shows a pretty significant MR despite that annuloplasty ring. So she was also referred then for a TE, and I heard that other institutions do that too. I think obviously that's very important to do for preoperative planning. So here's the Transesophageal Echocardiogram. These are the pictures from intraop, but you can see here the ring. I can show here. Part of the ring, you can see that the posterior leaflet is really, really small. The anterior leaflet, though, is pretty long, but you have severe MR. And then I have to play this for some reason. I always click it. So here's the 3D TEE, and I can just fully agree. Obviously, if you need someone like Richard and all the other excellent echocardiographers in our institution to actually get these pictures so that you can plan your procedure well. Otherwise, it just doesn't work. So here again, just to orient yourself, here's the incomplete ring. I'm not sure if anybody can identify any posterior leaflet here. You let me know. And there's a long anterior leaflet. So preoperatively, 87 years old. She has failed optimal medical therapy. I think that's always important too, to remember that we should always have heart failure people involved in most of these cases so that actually they get the optimal medical therapy. Now, she had already a repair. The surgeons didn't want to touch her again now that she's 87. It's pretty short posterior leaflet, long anterior leaflet. EF is preserved. What to do? So options. I'm just throwing it out there. Some people might disagree, but options might be Tendyne Intrepid, off-label, I think, for sure. Not sure that these are feasible, but any kind of coaptation therapy. Can we try coaptation therapy with MitraClip here? And how would we do that? And then really no good intervention option, maybe just medical therapy and comfort care. So since my talk is relatively short, who wants to do A? If you have the option, if you can, Abbott and Medtronic have agree on the therapy, do you think that would be feasible? Nobody?
Well, first of all, what do you think the pathology is? Why do you think she got recurrent MR? That should help you decide what you want to do. So why do you think this lady, who I assume had a good repair to begin with, now had recurrent MR? I think the answer was on the 3D echo.
Yeah, the ring is not right.
The ring's not right. It didn't go all the way to the commissure and the
it's all like that.
So it left some of the posterior annulus, which is now expanded, and what you've done is you expanded part of the posterior annulus. So all you need to do is retighten that up.
That's right.
You have a couple of options there.
Yeah.
So I'm not going to.
So would you take her back?
I will say I don't want to operate on her.
Okay.
But, we've done 15 of these post repairs, and the real key is that they're not posterior graft. I think the first 12 are impressed right now.
Yeah.
But it's a MitraClip session, so we'll go.
I guess that's what it's going to be, right?
What you need is, this is also, look at it, almost take a cardioband and just trace around and go all the way up.
Yes.
And this, to me, is a great cardioband case.
So that would be an option, right? So we don't have that option right now. We might have another option soon, but at that time, obviously, we really had only one option or two. nothing or
Well, since
do
it's a
much.
MitraClip talk, I'm going to vote MitraClip for.
That's an excellent choice.
Manny beat you to it.
Very good. Now the cool thing would be if I've surprised you now, but
That's right. We're actually going to see Cardio Band an hour early. Okay?
that's right.
Here, it's on the computer.
All right, good. So here's the interop again. Now, as you can see, the clip is oriented quite nicely. Again, here's that incomplete ring, the long anterior leaflet, and I think that's an important point here with the long anterior leaflet. And
It
so,
looks like Cardio Band, Mike.
so Paul was able to actually grab the anterior leaflet, and then, as you can see here, I hope you can see it somewhat better here. The other part of the clip is actually attached to the ring. Yeah. So obviously that's off-label, but it was a good result. So part of the clip is on the long anterior leaflet. And I think, I guess you agree, Paul, without that long anterior leaflet, I think we had 1 or 2 cases like this now. You probably never reach this goal. But if you have a situation like this, and if you don't have a surgeon who wants to reoperate, and if you don't have any other annuloplasty device, I think you can try if you're an experienced operator.
It's really on the ring, or keep on tissue close to the ring. Have you ever tried to close one of these on a ring, just on?
Yeah, so it's on the ring. And do you have a fluoride image or anything?
I don't think so. Yeah.
But it's you essentially just grab whatever tissue you can grab. There is very little posterior leaflet there to grab, and just pull it against the annuloplasty ring. And we've done this on 2 occasions, so it's worked relatively well. The transeptal has to be very posterior, because you're going to want to drag things posterior when you do it.
So is it stable after that? I mean, what is it actually holding on to?
The annuloplasty ring and whatever tissue there is there. Yeah. Mm-hmm.
Mhm.
Yeah.
So Paul, have you ever just taken one of these and closed it on a ring just to see what it looks like when it closed?
Not grossly.
It'd be interesting to see.
Yeah.
what it looks like.
Yeah. Mm-hmm. I mean, the radial force, or whatever force it is, it's actually really impressive. You cannot pry these clips open. It's really strong. So.
Impressive result.
Yeah. So here's 3D.
I've seen some surgeons thought they'd take some of these in when they reoperate and just grab them and pull them apart in surgery. You
Yeah.
You can't. You have to stick a little thing in the middle and unscrew it. Yeah.
Yeah. So the result was great, and then I thought, okay, now I'm going to prove what Paul is doing here, and found a 1 year later echo here, and it's still great. I think it's still maybe what we call it now, mild mitral valve regurgitation.
Manny would call it 0.
0. No plus.
He would tell the interventionist, there's 0.
I usually tell it on and say, what do you want to do?
0 is good.
Well, Paul is one of those who always wants to have the truth, right?
This is where
So it's
Dr.
mine.
Bannon comes in.
It's mine. It's mine. So just as a summary, this is an off-label use of the MitraClip, but for failed annuloplasty, if you have a long anterior leaflet, I think it's an option at least to consider. Now that we have other annuloplasty devices, that definitely is another option. If you're very experienced surgeons, we have those, but you might, obviously you try that again, but that might not be an option overall. And other TMVR MitraClip devices might even improve for future therapeutic options here. Thank you.
I actually think in the future we won't be attempting those. I think it'll be Millipede or Cardioband, something else. I mean, you agree, David?
Yeah, absolutely.
How do
Yeah.
you put a Cardioband with a pre-existing ring?
Yeah.
It's going to be difficult to screw and reduce. What
Yeah.
was that?
Probably it's
Yeah.
going to go in the I mean, there's
Yeah.
going to be enough tissue around it, and there's going to be tissue growing all over it, and the screw
Yeah.
will bounce off the ring. I think it'll, and the truth is, it's probably stronger tissue, fibrous tissue.
Yeah.
I think it'll hold it tighter.
It would have to be a flexible ring, right? Because
Yeah. But and I think the Cardioband would get up to the trigones better. If you look at this, it's an incomplete annuloplasty ring. It looks like it did not go all the way up to the trigones, which is, I think, why she developed more MR. In addition to that posterior leaflet, probably scarring down after it was resected. I mean, that's my interpretation. Mike?
I think even if it wasn't a very flexible
Yeah.
band, if you went all the way up to the trigone
Yeah.
and pulled it up, I think
Yeah.
you'd fix it. I mean,
Yeah.
the ring was improperly put in.
Yeah.
But Mara, you make a good point. We haven't done a lot of these in pigs and animals to see, with rings in them, to see what's going to happen. So it's going to be some of the, as we saw today. Yeah.
I'll make a quick comment about the imaging. You know, we've done a fair amount of ring cases, and the imaging was notoriously difficult. So kudos to that imaging there. It's very hard to visualize. You can always see the anterior leaflet, but you really can't figure out what you're grabbing on a posterior leaflet. There's a few cases where using ice to look at the actual patients with prior anaplasty rings, but just with TD alone, that was fantastic.
That's a great comment back to what we were talking about, what imagers have become.
Yeah.
Yeah.